My experience started back when I was about 20 years old. My sister was diagnosed with melanoma at the age of 24, and she survived for 4.5 years. It was at the age of 28 and a half that she passed away. During that time, she had 4 major operations. So in that space of 4.5 years, I become very aware of the dangers of skin cancer and melanoma especially. And then 6 months after that, I was diagnosed with my own basal cell carcinoma. And through that time there, I had 30 radiation treatments and 3 reconstructive surgeries with follow-up of hyperbaric treatment and also post-laser treatment.
I think the first time that I heard the word melanoma was or became aware of melanoma was when my husband was diagnosed in 2006 after our elder 2 boys, aged 2 and 1 at the time, jumped on their dad's right leg, and we found a lump in his right groin area. It was kind of scary seeing a lump there, but it was certainly a lot more scarier once he had that lump removed to learn that it was a melanoma. And Rowan went for the surgery, had that melanoma removed, and we thought, well, okay, we've had it cut out, it'll be fine. But that's not how melanoma works. It was 2008, 18 months after Rowan had that initial diagnosis, when he went for a walk one morning and stepped off the gutter and felt something go in his back, that we had to go and get it seen to. And it was New Year's Eve of 2008 that we learnt that just cutting it out wasn't okay. The melanoma had metastasised, and New Year's Eve of 2008 he was given 3 months to live. We fortunately got 7 months after Rowan's diagnosis, and I say fortunately, you take 4 months when you're only given 3. But on the 17th of July, my husband didn't come home from work anymore, and I was left a widow with our 4 young boys, aged 5, 4, 2 and 1. Such a tragedy to not have the kids race out the door to greet their dad when they come home.
Queensland men are 2/3 more likely to be diagnosed with melanoma than women, and those men that are diagnosed are 3 times as likely to die from that diagnosis.
So as young blokes or it doesn't matter what age you are really, but we all think we've sort of got that invincible touch. But the matter of the fact is we're not invincible, and we need to take these extreme measures, especially in Queensland, because the high UV radiation levels here.
The best way to reduce your risk of skin cancer is to protect yourself in 5 ways every day. Remember to seek shade. Wear a broad brim hat and long sleeve shirt. Wear wraparound sunglasses and apply broad spectrum SPF 30 or higher sunscreen whenever you are outside. Adopting the 5 sun-safe behaviours is particularly important for men.
So yeah, it's all about making that behavioural change and thinking that we can live here longer if we take these important steps.
And I think the awareness of melanoma needs to be more vigilant. The prevention, the early detection of melanoma needs to be more out there, which is why I founded the program Danger Sun Overhead. There's nothing more rewarding when you've done a workshop in front of a lot of men and shared your story and prompted them or asked them, pleaded with them to go and get their skin checked. And they do, and then you get that phone call, you saved my life. That makes it all worthwhile for me. Losing your husband that isn't coming home to me anymore, but to have someone's husband, someone's father returning home.